Hello everyone. In today's episode, we're joined with Omer, and today it's gonna be a very interesting one because it's gonna be all about the medical field with like autism and all sorts. But it's gonna be mainly focused about autism. But we're gonna see what Omer does like in the medical field, and it's also a lot of studying as well, I think. um, well, thank you, Omer, for joining me today.
Thanks for having me. I'm happy we're finally doing this face to face after talking on Instagram for a while.
Yeah, yeah. I think yeah, it's good to be face to face. With finally, and it's your first podcast, isn't it?
It is. I've actually had my first live also 2 weeks ago, and this is my first live podcast. I'm a very big fan of podcasts, but it's my first time being on a podcast, so it's
Yeah,
very exciting for me.
yeah. Because I suppose it's exciting when you do new things and try new things out.
Yeah. Even all of the, like my page, Diverse Med Ed, which I started I think 2 months ago.
Mm.
I've never been too much on Instagram or Facebook and all these things before, but now, first of all, I'm a bit addicted, which is a bad thing, I think, and it's a lot of work. I never realized how much effort people put into like their social media platforms, Spotify, podcasts. There's a lot behind the scenes that goes there. So kudos to you, really.
Well, thank you. Yeah, because I suppose it takes a lot of your time, doesn't it? Like with people putting posts up and there, like I suppose you can schedule what ones you want to go on per day. Um, so yeah, it is very interesting, and like I'm looking forward to like to hearing like what you do because I think it's very important with certain topics like with autistic people as well. Like myself as well. Yeah, so it's gonna be really interesting about to hear what you do and why you want to do it as well.
Yeah, for sure. So I want to first explain actually how I got into this whole idea, which I think it started during the first wave of COVID. Um, I learned a lot online through this online medical platform called Osmosis, and they do webinars sometimes. And one of those webinars was by this very nice lady who has some degree of hearing loss. So first we had some homework before the webinar. We had to listen to her on YouTube, which I gotta say was very hard for me because she does speak a bit differently because she has some degree of hearing loss. So her, speech patterns is a bit different than mine. And I started wondering, if I have a patient like this, I have never prepared before. It might be the first time I see a patient like this, that's like diverse, not like, like the majority of the population. And first of all, interaction wise, I have no idea how to interact and I don't want to be awkward with her. And then during her webinar, I did understand her because I've had some practice from her YouTube video. And she explained how to better interact with patients like her with hearing loss, with other types of patients. She gave a few examples. And after that, I just started thinking, if I have, let's say, an autistic patient, if I have a patient on a wheelchair, if I have someone who's dark skinned, there are so many things we don't learn in medical school or in the hospital after. And I didn't want my first time to, have a bad interaction with someone. And it can also affect that diagnosis later, or just the interaction might make them be a bit closed off, or it might be awkward. And I do want them to have a good feeling when they come out, and also to be able to diagnose and to know the most relevant medical info related to each of these diversities.
Yeah, I think that's like it's like I suppose it's a learning process for you as well because you're listening to and like gaining knowledge about like it could be autism, it could be like what you're saying. So it must take a while for you to suppose to process what you're learning so you can take it out like on the job as well.
Yeah. Also, we do learn a lot in medical school, and we say our studies never end. We always keep learning, but there is a big gap in diverse medicine about diverse patients, because let's say even dermatology, we see only white skin and we hear only those symptoms and how it would look, or we've never really seen in the hospital too many patients who are diverse, which there are, but either we don't see them because it's too difficult, so the teacher or doctor might not show us, or because there are a bit less in the population, so we don't see them every day. But then the first time I might see a patient who's a bit different or diverse might be when I'm already a doctor. And that'll be my first time having to interact, and I might not know some really important, relevant medical info that might help me diagnose better and treat them better.
Yeah, yeah, I totally agree with what you're saying, because like in the past, like so you may like go to hospital and or the doctors and people won't understand, like yourself, like you might not be comfortable speaking about it, and they might not understand why. That they may think you're just being ignorant or ignoring them when it's not. There's more things. So I think that's why you have, I suppose, maybe a consultant or a doctor that you'll have a strong connection with, that does understand you. And it should be, I suppose, more like that with a lot of, maybe a bigger range of people.
Yeah, I completely agree. And I do realize that I'm asking a lot of medical providers to know about every category I have right now, not to know everything. I don't expect that. I do think there should be some minimum knowledge about those different patient categories, let's say. And I do tend later on to maybe create some sort of platform that if someone knows, oh, I have a patient who has a chronic disease, or let's say it's part of the LGBTQ or some other category, then he might just pop into the platform, read a bit, and gain some knowledge before that patient interaction, before that meeting.
Yeah, because I like in my hospital, it's like I've had a few experiences where it's I suppose tough, and like because I don't like close contact anyway, like with people, and I got put because of my Crohn's. I had a bad flare up, and I went into, they had to put me in A&E because it was an emergency, and really in an ideal world I shouldn't be in A&E, I should be somewhere else, because a chronic condition is not an accident. So I'm there sitting there and waiting, and then for there was like a room I go in, and that they've recently brought that another room back because of a person who passed away last year, put a fund into this room where people can go in if they're feeling uncomfortable in a large crowd, which I thought is good. And like rather than sitting in with so many different people that you're uncomfortable about it.
Yeah, so that's amazing. And I think even, let's say, with chronic disease, I spoke a bit with Jess, who was on your podcast a while ago.
Yeah.
And she does have a sort of rare chronic disease. So for her, I remember it was very frustrating that if she went to a new doctor, she would have to re-explain her disease again, what she has, diagnosis, what it is even. And I thought it's so funny that even, let's say, the specialist who diagnosed her, if he just wrote some additional info or like real definition and her specific symptoms, just like with Crohn's, because Crohn's can have a wide range of symptoms and it's very specific per patient. So if the one who specializes in it and diagnosed you can just write some extra info to kind of pass it onward, to the next medical provider, that'll save them so much time. And also, if a medical provider knows he has a patient with a chronic disease or some sort of rare disease, even reading up a bit before will save so much time. Instead of me asking you to explain me your disease, I can like just jump into the relevant questions.
Yeah, I completely agree. And yeah, it is that's very useful for like the next one, just to know your information rather than having to explain yourself again, which it gets tiring. You have to explain yourself and a lot of the time, but yeah, like I think that I haven't come across kind of a situation with my IBD nurse. One who's on the ball kind of moved on to to a different place in the hospital, so she's not where she was. And when she left, you can tell she's gone because she was on the ball, and that others wasn't, I suppose, like her as much. So you can tell the difference, and like it'd be nice if someone like that was there in that role rather than just not, and like you having to be on the phone all the time, more often than usual when phone calls are pretty tough sometimes.
Yeah, it sounds real tough, and it shouldn't be like that. That if someone leaves or one specific person, then you really feel it. Of course, if they're very nice, then you feel it. But their interaction, the way medical providers interact with diverse patients, can be a lot improved, and that's what I post about. So my page, Diverse Med, and I post both how to better interact with different patient categories, like specifically, and also medical relevant information. Because after that first webinar, when I first realized that it's really important, I want to educate myself. So I started looking for it, for info. And the information is there, but it's first of all very hard to find sometimes, and it's always separated, either interaction-wise or relevant medical info. And it's always about one diverse category, like one diverse patient group, and not all of them together in one place to make it easier to find.
Yeah, because there's so many of categories, isn't there? Like you could have a disease, or you can have like neurodiverse, and like other people. So it's not like, I think it's really good what you're saying, because it's not just like people are all these categories are in one thing. That there's different, and there should be people possibly trained in the hospitals and surgeries and places like that know of these different things, rather than people having to explain why they can't do a certain thing or feel uncomfortable doing something. So yeah, I think it's really good, like the little page you've got going and the little community that you're starting.
Yeah, thank you. I'm working on that community. And yeah, so I think even for instance, with autistic patients, just even the terminology, sometimes I think medical providers or just my fellow classmates, medical students, if they see an autistic patient, it might be very awkward for them. Even just the name, I had to look up myself, autistic patient. How do you say it? Is it okay to say autistic patient or patient with autism? And even there, I saw there's like some dilemma, and some people say that's okay, some people say that's more okay. Yeah. But I think we should talk more about terminology and what you can say. For instance, with transgender patients, how do you ask about pronouns, or making it clear that you should ask all patients about their pronouns, to make it for all of them more comfortable, never to assume.
Yeah, I agree, because like having autism, you maybe don't take things the way someone else might think they are, which I think that's good. Like if the person has some idea or knows of it and has some training, like it'd be good if like we see in schools, like teachers have, especially in special schools, teachers have their autism training, and I don't know if that happens in the medical field, if like doctors and people like that have that, because yeah, it'd be interesting, and if they don't, it'd be good if they did, just so it will make people more comfortable. And like, for example, if someone's more severe autistic and they're sitting there in the chair just maybe rocking back and forth, for example, like a person that works there who doesn't understand may think they're just doing it on purpose when they're not. And it's something that, yeah, it's something that needs to be looked at, I think.
Yeah, so I can't speak for all hospitals, but I did look, and at least in my university, and I know many other universities, we don't have any teaching or any classes about these diversities and how to better interact. And later on, also in the hospital, it is becoming more and more, there is an increased awareness to these issues. But I do think that so far we are very lacking in learning more about these, let's say, minor diverse categories, because they are not the majority of the population. But that doesn't mean that we don't need to address them also, which is why I never put statistics how many autistic patients you might see or how many LGBTQ, because I don't think the statistics should matter too much. Because even if there's a small group of the population in that country or city, we should still know or have some platform to learn how to better interact and treat them, even if it's just a couple of patients.
Yeah, yeah. Has this always been, I suppose, your, let's say, dream job to do, like going to like the medical field?
So I always joke and I say that my first time that I really wanted to be a doctor was after watching House MD, the TV show, because House is awesome and a genius. But no, even before I started watching that, I always knew, I think since I was a little kid, my parents told me even nowadays that since I was a very small kid, I always said, I want to be a doctor. Unrelated, my dad is also a doctor, but I never thought of becoming a doctor because of him. There was no pressure from home. It's just something I always want to be, and I really like helping people and treating and seeing them improve. But also the interaction, interacting more and better interaction and knowing the relevant medical info is starting to become a very big part of who I want to be as a doctor, because I do see it's very important. And even for me, I'm part of the LGBTQ community. And even a few times when I was on the patient's end, I had some, not major, but some unpleasant experiences. And I saw how it affected how much I shared later on with my doctor and also how I felt. And that can affect later, not just the interaction, it can affect the diagnosis. If I don't share everything, if I don't tell my doctor everything because I don't feel comfortable, it can affect what he'll prescribe me or what he'll think I have.
Yeah, yeah, it's hard to, like, I suppose, speak about all sort of things, like if you're diagnosed with something, it is hard to not, like, for example, when you're diagnosed with autism, it's hard to speak about it. I think any age, I think when you get diagnosed with something, it's hard to talk about it because you're in shock and you don't understand, I don't think, what it is yourself. And I suppose, like, like for you, and I like learning about these different things, it's kind of getting diagnosed, I suppose, in a way that you're learning about all these like you got autism, you got chronic illness, and it's almost like that, and you're just learning from the start. And then I suppose the one that more, it's like anything, the more you learn about something, the more details you'll learn and the more knowledge you will gain, I think.
Yeah. For me, it's dangerous because I need to focus on my current studies as well. So I usually work on this in my evenings, but it's like a rabbit hole. Once I start reading and about one category, I start reading and I just learn more and more how much I'm missing and how much more I can share with my audience and how much more I can take to my next patient. It's kind of scary how much we don't learn in medical school about these diverse patients. For instance, even if I have an autistic patient, I will see him not because he's autistic, he's coming because of something else, right? It's just part of who he is.
Yeah.
I'm not sure how many, but I'm sure many times the doctor will pay more attention to him being autistic, and maybe it'll be a distraction for him if you don't create, the right environment for someone like that, because they have their own needs, just like any other patient might need something else. So just by creating the right environment, less stimulations, maybe a more private room, quiet, if smells can be an issue or touching can be an issue. So just by knowing these small things, I can really change the whole interaction and then focus on seeing why they came in the first place and diagnosing them correctly and helping them get better.
Yeah, I think that's that's it, because you, like, as you say, like, it's like I agree with everything you just said, because it's completely true. Like, it's how, like, the doctor or the person is there, it helps your so it helps your presence, like how you're feeling and stuff, because, like, everyone's different. Like, a person's going to be different, and the more you've seen that person, the more you'll know what their what helps them. They might bring I suppose something to fiddle with. And like me being autistic, every time I do a podcast now, I always always take something to fiddle with myself. Yeah, so like quite recently I'll be doing like spinning like one of these around like with the earplugs things, and I suppose it just keeps me concentrated. Well, not concentrated, just comfortable actually. Um, and yeah, like everyone's different. Like so yeah, I think it's good that the more inclusive you make it, the more better and feeling it will give the autistic person or anyone that you're seeing.
Yeah, and it's not just like interaction wise, also
Yeah.
some, let's say, medical relevant info. For instance, a lot of the LGBT community might suffer from depression, or even I read some researches about autistic patients who might have higher chances of depression, or some related diseases are higher in them than other patients. Just like in LGBTQ, you might assume something, for instance, transgender patients, we always have to think of depression and what hormones they're on currently, because it might affect what medication you'll prescribe later. So it's not just interaction, it's also really important medical information. And I do think my page can be interesting for the patients themselves, because I believe a lot of patients from these diverse groups don't realize what interaction they deserve, or how a doctor should interact with them better, or just the medical relevant info. They're not aware of these things. And if they're aware, unfortunately for now, they might have to educate their doctor, because as we see, these things are not taught in schools or in hospitals. And I also said this in on Jesse's live Instagram, that it's better to correct them now than to be angry later that, oh, he didn't do this, he should have asked me this. Or so it's better to correct and do the active part ourselves, even if it's annoying, and hope that in the future we will learn how to do this doctors by ourselves.
Yeah.
But yeah, I think it's better to educate them, or at least to know what you need to let them know about.
Yeah, I think that's great, because yeah, like I think it like exactly what you're saying. Like I've actually spoken to the people who are autistic, and they say to me that it's quite common for people who have autism to have like a chronic like illness or condition. And I've actually met a few people that have Crohn's and autism like me, and I feel like it's not many. Like I either normally find someone who has autism, or just on its own, or Crohn's on its own, and like so seeing other people that it's good, but I suppose it's not good. I suppose with the illness with Crohn's not to have, but it's good that people more people have it, because at first you don't get really educated. You kind of have to do it a bit yourself.
Yeah.
Yeah.
And have you ever noticed or experienced any issues with, let's say, medical students, if you've ever seen, or medical providers like a doctor, nurse, that maybe it was awkward for them once they knew you have you're autistic, or with your Crohn's, maybe they didn't know something about it, or
There was this one thing. Back when I wasn't diagnosed with Crohn's, I had a doctor's appointment, and because of my Crohn's, I have something called a fistula. It's at the back passage, and didn't know that at the time. I just felt it there. I felt something there, and asked, my parents asked, and if she could have a look, and stuff, and she said she didn't want to make me feel uncomfortable when I'm like, I was kind of happy to be uncomfortable just to see what it was and stuff. And she didn't. I think the fact was that she was uncomfortable, and because I didn't see my consultant for, I think it was another 2 weeks later, I think it got a little bit worse, the fistula, and more sore as well. So he saw it and stuff. So like I think, yeah, that was something that I wasn't happy about. And like, if you
Right.
did see it, like considering she's a doctor, even though it might not be her field, to do it, but I think that's the reason we was there. And if we wouldn't have came, if that was the case. So yeah, that's just one thing there.
Yeah, wow, that sounds very, very hard and annoying. I would think if it happened to me.
Yeah.
I think for me, I didn't have too many experiences. I do identify as gay, and I actually wrote for Osmosis. I wrote a blog for them about my experience as a, let's say, as a gay medical student, how it is. And one of the things I shared there was that before I started medical school, I did go to my doctor to have some blood tests for just STIs, like a regular checkup. And then he casually told me, you should bring your girlfriend, or you should ask next time to also get checked up. And I remember I was just about to ask him some more specific, let's say, MSM things. MSM is males who have sex with males. That's a bigger category for, say, gay, bisexuals, and everything in between. So I was about to ask him some, some medication I can take or vaccinations I should do maybe as a gay man. But when he told me next time bring your girlfriend also, instead of no, next time bring your partner, it did kind of shut me up, because I wasn't sure how he would react. He was a bit older, let's say. He was like an older adult, let's say. And I wasn't sure how he was going to react to me saying I'm gay.
Yeah.
So instead of asking all the questions in my head, I just kind of shut up, and I told him thank you, took the paper, and I left.
Yeah.
And I did miss there an opportunity to ask and learn more, instead of going to Dr. Google, which is never, I think, a good option.
Yeah. Like, I'm sorry you had to be put in that like situation, because like it's many people do like make those kind of assumptions, don't they? I think not without just realizing, like, because they wouldn't know like that, and they kind of make those assumptions and stuff, which isn't right. But like, I'm sorry that you had to like you felt like you couldn't say to the person that yeah, it's not right, I don't think.
I believe it was really harmless. I think even before I was more aware of this, I might have said the same thing, right? Because it's natural to assume, let's say, that most of the population is straight, right? So let's saying bring, and in English it's harder, but in Hebrew we have more like stronger male-female grammar. So it's very easy to say bring your girlfriend instead of a partner. But just by this extra second of being aware that there are all these different patients you might see, and just thinking of the terminology, it can really do change the course of the treatment, or just like the interaction and what goes on in the examination room.
Like, I think like more has to be done with like understanding of like all these things that we're talking about. Even though there might be a little bit, it just reminds me of, I know school is completely different to the medical field, but mainstream, that wasn't, in my experience anyway, it wasn't really taught with people. Like, they didn't really understand autism when they said they did, when they didn't. Because in my opinion, being autistic, I wouldn't tell anyone I needed help, because I didn't have the confidence to. And it's like anything, like if you don't have the confidence to do something, or suppose you hide it and then you don't talk about it. And what I found with having Crohn's now is, like, if something's wrong, it's best to talk about it, because things can get a lot worse if I don't talk about something.
Right, yeah. I am wondering what you think about this. I have a Google form and my Instagram page. I ask people if they want to share their experience as patients, and then I either anonymously or not, I share there. And one of them did share a story that a very nice medical student asked, he is a transgender man, and she asked him if he could stay for a bit longer and ask him questions about him being a transgender person. So we both agreed that it is nice that you want to learn, but asking the patient to stay after his time, after the appointment, for let's say additional 20 to 30 minutes on his own time, asking him to educate her. I do believe it's very nice that you want to learn, but I do think it's more on us as medical providers to learn than asking our patients.
Yeah, yeah, I agree. I think you do, and like it's your job to kind of research, and I think I suppose it's a fun job for you if you like enjoy it, because you're learning like you say every evening or most evenings um um learn about different stuff. So yesterday you might have done a little autism research, or tomorrow you might do some hidden invisible illnesses research. So even I'm learning with that, because I speak to a few different people who come on the podcast to speak about some different chronic illnesses. So and they are quite interesting, and people do have more than one, which I think people miss as well, because I suppose I'm fortunate to have one, but it's a bad one. They're all bad in their own way, but it's one that I wouldn't want really, or it's kind, because it kind of affects literally. Well, mine will affect from my mouth to like all the way down, so it's not nice. But yeah, I always feel for people that come on and speak to me about other chronic illnesses that I'm unaware of.
Yeah, I agree. I think so far I'm researching, let's say, actively on 12 different categories, and I'm always coming up with more ideas of what other category to add, or I'm always debating if I should make it broader or smaller. Let's say I'm after talking with Jess and now you, so I did start researching more into chronic diseases. At first, I was just wondering if I should have a category just about Crohn's, or just like general chronic diseases, and then just going deeper and deeper into them individually. So for now, I'm doing generally about chronic diseases, and then I'll go maybe more in depth about each disease itself.
Yeah, yeah, yeah. I think that's good. Like you do that, and like when Jess came on, it was like a very good talk with her, and like yeah, because she's based in Belgium, I think it was. Yeah, it's
Yeah.
Belgium, yeah, and she's Australian. So yeah, it's quite interesting. I think you said you're based in Israel, was it? And then you're in your Czech Republic now.
Yeah. So I'm from Israel, but I'm studying for all my 6 years, and this is my 5th year. I'm studying in the Czech Republic. And later on, I'm not even sure where I'm going to go. I am thinking of maybe the UK, we will see, or somewhere nearby, mostly probably English speaking, because I'm not down for learning another language. I do learn here Czech,
Yeah,
which is really hard, I gotta say.
yeah,
So I'll settle down somewhere English speaking, probably.
yeah. You come to England, let me know.
For sure.
Yeah, but yeah, so you've been there 5 years in Czech Republic then,
Right.
5 years.
Yeah, and I have next year, and then hopefully I'll be done and I'll be a doctor. And I do hope to continue with this even next year and the following months. I do have plans for it to expand it more than a social media platform. I'm just starting now because I want to see some public opinion. Also, it's a way for me to research and kind of publish it in, let's say, bite-sized info.
Yeah.
I do try to always back up everything I say and write on my Instagram and Facebook. I always try to back it up with research, medical research, or if it's more interaction wise, I do try to find some websites that say that specialize in that field, so people can look up what I'm saying and see it's not just like Omer made this up or something like that.
Yeah. Yeah, I think it's good. Like you're like I think it's good that like where was you actually like born then, like the country you're actually from, like yeah.
Oh, that's complicated. I was born actually in New York, in the state of New York. My dad did his internship and residency in the hospital over there. So I was born there, and then we came back when I was around 6 years old to Israel. And now for the past 5 years, I've been in Czech Republic mostly. And vacations, I go back home to my parents.
Yeah. So what was it like these last few years and like pre-pandemic, like ongoing COVID times? How is that in the Czech Republic?
You mean pre-pandemic?
Yeah, like the restrictions and stuff. Like how did they do things in Czech Republic?
Wow, that was the first wave was really tough. Luckily, my boyfriend is local, and his parents have this like very big yard and a very nice house and a dog. So for the first, I think 3 months from like March till June, we kind of just stayed at their place. So we kind of rode that out like very, and they live in like the periphery of the city. So we're just there the whole time. And we had some online teaching. It was very hard to not interact with patients and not see patients. I felt like first I was losing my interaction with Czech patients, because I need to speak Czech. And also it is hard, you have to learn how to interact, which is not something we actively learn too much. We do learn a bit, but not as much as I would like, how to better interact, just with patients in general, not even diverse patients, just how to interact and talk to patients. And I did feel like I was slipping with that. Luckily now we are starting to feel that we have less restrictions right now. Things are open. The skies are open. You can fly here. You can also fly to Israel right now, which is nice. So right now we are kind of back to normal. Some of my classmates did have COVID recently, so just quarantine for 5 days, and you come back and keep working and studying.
Yeah, it's quite tough, isn't it? Because like for people and for like people to have underlying health conditions, it's like, including me, it's pretty tough because like it's still here, like the pandemic's still going on, kind of. But it is, and like other people don't, I suppose, realize that, and like even doctors and people actually don't. They kind of, because restrictions are no longer there, they kind of think it's over some people. And a person actually said to me that it's over now because I don't know anyone that has COVID and stuff like that. And it's not, is it? It's still here. I've actually, people have said to me that that in the past week even, I've seen a few people that we've heard of a few people that's got COVID. So yeah, it's harder it's probably much harder than ever in this pandemic for people with underlying health conditions.
Yeah, I can't imagine also with less doctors, or they're more overwhelmed, overworked. I'm sure people, and especially those who need maybe extra attention or a bit more complicated than the normal, I'm sure it's harder because the doctors are overworked. Maybe they have a different doctor taking care of them who's not aware of everything they have. And if it's not, very clearly written down, or if they didn't learn how to interact with those patients, unlike let's say like your GP or your long-term doctor who kind of knows you already, if it's a new doctor, it might be a whole different experience. And especially during the pandemic, I'm assuming that's not a fun experience.
Yeah, it's always good to have one that's understanding, isn't it? Like a doctor or a GP that like my personal doctor, I've had her since I was little, so I've always had her, which has been great. But I suppose change is hard for a lot of people, like changing places and stuff.
Yeah, I'm sure it's tough. And I think even during normal times, let's say when the hospital is not overworked and overstaffed, then there are certain things that if we just implement generally, let's say just having a form you fill before, maybe we can, if I know you have a chronic disease, you might fill there are some things, or bring beforehand. I saw Jess shared about this medical passport. I think it's an interesting idea. If you have, let's say, a more complicated disease that's very also specific, like Crohn's, which is very specific per patient, and let's say you have something happen, you have to go to the ER, or you're seeing a new doctor, then just bring the info beforehand or fill in some kind of form or informing the doctor beforehand, or if the doctor asks beforehand in some way, might really ease the treatment and interaction and even save time on both your ends.
Yeah, I think that's I think that's great. Like especially what I remember just speaking about that, like a passport, which is great. Because that they had that yeah, I think that's like a really good idea. And like for people in the Crohn's and ulcerative colitis community can have a just can't wait card. So for example, if you're going into a public or disabled toilet, or even a restaurant that you need to go in quickly, you can show it, but it's not law. Like, it's up to them. But in the past, I've actually tried to do that. I've tried to. I wanted to see if they would let me go in to the toilet without showing my just can't wait card. So so for example, I went into a restaurant that didn't have a public toilets. They had staff only, and I said to them, "Can I use the toilet?" I just said that. I didn't say I got Crohn's to start with. I just wanted to see if they let me use it.
Right.
And then they said, "No, sorry, it's only for staff." And I said, "I've got Crohn's. I've got Crohn's disease. Can I use it?" And then they repeated what they said a minute ago. And then I asked them if they knew what Crohn's was, and they said, "Yeah, I do." And then I showed them the just can't wait card, and they did let me in, because I kind of said, if I don't go in, I might you might have a little spillage to clean up in a minute. But yeah, they did let me in, and like the just can't wait card is very useful, and it's unfortunate because many people in who have chronic illness and they use a disabled or people that I suppose are not in a wheelchair, for example, do get looked at, and they kind of think, why am I using the toilet if you're not in a wheelchair or not disabled in that kind of way, which is upsetting that like people look at disabled people that way. Like they don't look a disabled person like a normal person. I say normal person like me or you that is not in a wheelchair, that needs to use the loo because of a condition that's not visible in like on the outside, but in the inside it's much worse.
That is so true. And I've just seen a lot also on Instagram from patients, how they kind of talk about it either in TikTok or Instagram. I saw a lot of these interactions and them speaking about this. I think even for medical providers, it's a problem if we don't, sometimes you can forget if you don't see it, or, you know, assuming that someone who has hearing loss or some vision loss might be able to see some things or even, you know, read a sign, or someone who doesn't use necessarily a wheelchair might still have some sort of physical disability.
Yeah.
And yeah, I think even for us, it might be sometimes we forget, and it might be a problem.
Yeah, I think it's a good sign to look into, because for example, in the past I've been using the toilet, and then you'll get people on the outside wanting to use it, and then you feel rushed that, like, I suppose that I think anyone would, that like you need to get out quick, or otherwise and like in the past actually I remember going to a concert, and there's a McDonald's, everyone's queuing for the toilet at McDonald's, and
Right.
And half of them I could say, well, I wouldn't have thought all these people were disabled, because they're using the disabled toilet, because all the others one were full, and of course if
Yeah.
other toilets are full, you're going to use the disabled toilet. And then me being disabled, I skip the queue, and then I go in it, and then I got people looking at me, yeah, like, why are you not at the end of the queue? And I think my mum was there, and they said, yeah, he's got Crohn's disease, he's got a card. And then I think we say to some people, do you have like proof that you're disabled and stuff, and that you need to use this card? And yeah, it's just stuff like that. And as well as like having a like for driving, having a disabled badge that you can put out saying that you can drive there. And even in the past, there's been people not knocking on a window, saying, I actually remember it's a fair while ago, but it wasn't pleasant. It was when I was younger, but what happened was
Mhm.
um uh, I me, me and my dad was in the car waiting for my mum because she was in the shopping, so we just went in the car with the disabled badge, and then a guy was just standing there taking pictures and stuff, like saying that you're not disabled and stuff. um and yeah, it wasn't nice because he assumed that I wasn't disabled and you didn't need it just because um, you were there and stuff. So it wasn't like you get these not nice situations. I suppose being a disabled person that are unpleasant sometimes.
Yeah, we really need to I think correct the image of how people, just not just medical providers, how people, as you said, in general, perceive, let's say, someone with a physical disability, which is just wheelchair and completely, and that's the only thing in their head that means, let's say, a physical disability, and that's really not true.
Yeah,
And I think, let's say here, the story is, let's say, now maybe it's funny, but back then probably very frustrating. But it can even be more severe, let's say, in a medical setting in the hospital. I've read a lot of research saying that in different states, let's say in the USA, where accessibility for wheelchair users, if it's the door, if it's just accessing and going into the examination room, sometimes it's not every room is accessible for them. And even if you go, let's say, one more step, they go into the medical examination room with their doctor, and there is no scale suited for a wheelchair. So the doctor just won't measure their weight, and the examination table can't move. So either they will ask a family member to maybe help move them to the examination table, or they might just not examine them and laying down supine, we call it, position,
yeah,
which sometimes it can. Sometimes we do need to check someone in different ways, standing, sitting, laying down, because it might really affect what we see and what we feel. If we palpate the body and what we see, it can have some difference. So if we skip that, let's say, step, just because they're in a wheelchair and we didn't prepare beforehand because we didn't know they were coming or didn't ask, so we didn't ask for a medical staff to come and help me, or they didn't bring a family member, so I'm not going to do it, and just skip this phase, it might really change and really affect their diagnosis. I might miss something because of that.
yeah, yeah. I completely agree, and like especially with like as you say, like getting diagnosed with different things, like that process needs to be, I think, more serious, and like consultants and doctors taking like the patients more, I suppose, seriously. And if they say something's wrong, that it does need to get checked, because like with my diagnosis of Crohn's, it kind of had to be a push diagnosis. Not, it wasn't easy like to get appointments and stuff. You had to push the people to get you an appointment and stuff, and because of how bad it was and stuff. So yeah, like the whole process with that needs to, I suppose, um, be a bit different from how I got diagnosed, because some people do wait years to get a diagnosis of certain things and stuff, even autism, for example. Like for some people don't get diagnosed till they're an adult now. I think you'll see more nowadays that um, people get diagnosed as an adult. I've seen more than getting young, like being like a young person. So I think it's something that needs to improve. Like even though getting diagnosed is probably hard, but it's nice. Like if I suppose doctors and people out there take like their patients more serious.
Yeah. Like I haven't added this category yet, but I know obese patients sometimes suffer a lot because of misdiagnosis, because their obesity is being blamed for all of their symptoms, let's say. And sometimes it's actually something else. And then, that you miss something that's really important and affects the patient.
Yeah, yeah. Like I think you'll find there's so many like different categories you'll find and you'll talk about out there, because there are so many. Like you've got like obese people, you've got neurodiverse, you've got um uh chronic illnesses, and like there's so many more. That you could think of 100 of them, I reckon.
Yeah, there are too many. And that's why I said I do want to start with Instagram and social media to kind of gain feedback, gain perspective, see how people interact with my content. And then later on, I do want to continue to some sort of forum or platform, and maybe even have some courses to educate in universities, medical universities and hospitals, because I don't expect medical providers to know everything. I think just the basics, and then to have a platform that when they know someone is coming or during that session with the patient, then they can look up something and see if they missed something in their questions, or if there's anything important they should know or think about during that. Which is why I think just recently I kind of realized that it's also important for patients to kind of follow my page and see, because so far we sometimes do miss stuff and we don't always know how to interact with diverse patients or the medical relevant things. So until all doctors know it, I think it's also a bit on us as patients to sometimes tell the doctor, or just comment how they should interact with us, or maybe ask about what I know is important medical information that's relevant to my group specifically.
Yeah, I think it's really important. And what made me kind of get in contact with you, because I saw that like that post you made about autism, about like in like the in like hospitals and in the medical field, and seeing how different people are, and I think that's really important. And as are lots of other things, but like the one I kind of talk about the most would be, I suppose, Crohn's, autism, different chronic illnesses, and chronic as well. So I think that's like it's a good start. I think you got, but I think as long as you enjoy it, that's the main thing.
Yeah, I'm really trying to juggle everything. Right now, actually, my boyfriend is in the States in an exchange, so I'm kind of filling up my time with this project. Yeah, so I'm trying to fill my time with more friends and this project, and also I do work as an intern for Osmosis, the online medical platform. So I'm juggling quite a lot. So I do try to first of all focus on my studies and finish medical school. And then I do this in the evenings, and I try to schedule posts. And as I saw, you also work on Canva, which I think is amazing thing.
Yeah, it's very helpful, isn't it?
Yeah, for so many things, even CVs and stuff, I really do enjoy working on it.
Yeah, like you can adapt to different things, create your own. It's much easier, and like I think I only started using it last year, which it's very helpful.
Yeah, and it's a good thing. I think I'm an overthinker sometimes, because I've been researching, I think, for a year before I started this diverse med ed. So I do have a lot of material ready, so I can kind of edit it and make a post. But also just thinking how to make bite-sized information for Instagram, and how to convey it, that's clear and simple, so busy medical students or medical providers can just get something out of this post and then move on, and next week see something else and take it and kind of absorb it. So I'm trying to make my content very clear and simple, so they can take away the most of it and then use it also. So I always add, if I can, steps, what to do, like easy steps, and I always try to make it also practical to use.
Yeah, because sometimes you can spend ages. I think I did a Canva the other day, and I think about 2 hours. I think it was like creating it and stuff, and I think like getting the right pictures that you want to use and stuff, or a particular design you want to do. So it kind of varies what you want to talk about, what you want to the topic, and yeah, it's fun. You play around with it.
Yeah, like what I write on my Google document and then appear on Canva, something's very different, because I realize I wrote too much, or it might be overwhelming, or just doesn't fit. Let's say for now on the Instagram platform, it doesn't really fit. So I have to like rethink it, add some images, make it more visually appealing, which is also, I think, an art by itself and part of the process of sharing information in a way that people will actually read it and not just have the info there, but have no one see it.
Yeah.
Just like your page, which is very visible and clear and easy to interact and see it.
Yeah, like I do use Canva. Like actually speaking today, I did upload, I think, a picture earlier, like the day we were recording this, and I did actually open a design that I made on Canva, and it was kind of to do with what's going on in the world, and like being an autistic person and not listening, I suppose, like with the news, like a lot, because I think the news can be quite overwhelming, for anyone at the moment. Anyway, and I kind of made that post to say to people that it's okay not to watch it all the time. Like for me, I do watch it more than I used to now. I think quite a lot of us do. And like before I go to bed, for example, I'll switch it on, see what's happening, and then I kind of want to limit myself not doing that all the time. Because it's on quite a lot of the time, and I do get updates on my phone, and which I actually said on the design. So it is, yeah, kind of linking that to autistic people as well, which I think quite a lot of them will kind of agree with that.
Yeah, I think it's really important to also know yourself. Also, speaking about medical providers, if you know your symptoms and what makes you more comfortable, even if the doctor doesn't ask, or there's, I don't know, let's say too much bright light, too noisy, touching, it is okay to tell your medical provider how you would like to be engaged and interacted with. I think it's important. If he doesn't ask or is not aware, he or she are not aware of it, I think it is important to say it. And speaking of overwhelming with information, yeah, I totally agree. During COVID, during the big waves, at first I did look at the numbers, listen to all the research and everything. But after a while, it was just overwhelming and kind of depressing because nothing changed. So I slowly just stopped listening to all the news, and I would just look at the major news or major updates once a week, and not look at every day the numbers increasing, because it was just depressing to see it, and it didn't really help me with my day-to-day studies and life.
Yeah, I think that's really good. Yeah, because I suppose it can educate you in ways, but another way is that it could be too much if it's like all negative, I suppose. Like while watching the news and stuff. But yeah, well, yeah, like we all have our different ways with, like, I suppose, coping with it and dealing with certain things our own ways.
Yeah.
Yeah.
And something I think I also spoke with Jesse in the live, I would like to ask you, is there anything you think medical providers can do maybe ahead of a meeting, or let's say before, if you had an appointment, before that appointment, if they can do something to improve, let's say because you have chronic disease, like you have Crohn's, and as an autistic person, if there's anything, maybe a form they can do, or something to maybe make your let's say medical examination and session better.
Yeah, I think I completely agree. Like one of the last things I wanted to ask you, because it's been, I think, a really good it's really good to have you on today, because we've talked about really good topics, really good lots of different topics as well, and I think that's really good, like especially when you're doing a podcast, even though there might be two set topics, but it's good that an episode that has a set topic that can expand and having all sort of different ones. But I just want to ask, like, what is your like kind of goals for like the future? Yeah.
So I would say personally, I think survive medical school and also keep my mental health in check. I think during the pandemic, I really learned how easy it is to kind of lose track and how important mental health is. Even if you feel fine, sometimes you're not fine, or even if you say you're fine, you're not fine. So I think I'm really working on myself to take breaks, do more mindfulness, work out more if I can. So that's personally. And regarding my project diverse med ed, I do have big dreams for it. It's even affecting which speciality, I'm starting to think more because I am 5th year, so next year I'll be done and then I'll look for a hospital to work in. So I'm starting to think which specialties I can do, which might work better with diverse med ed, and maybe I can see more diverse patients, interact more, because I do want to keep working on this. And I do want to see it grow into something bigger than social media, which it is right now. But I do hope to make it maybe into courses or some sort of platform and forum where people can learn and interact with their patients.
Yeah, I think that's like really good, like goals you got there, because like I think it's really important to have goals as well, because like they change all the time, like and there's no time limit. It's up to you, like I think on your 5th year you want to kind of I suppose be a doctor soon, like in the next coming years maybe, so yeah, it's good, and like hopefully we might see you in the well, I might see you in the UK.
Yeah, maybe, and even if not, I hope we can have more podcasts or live Instagrams and collab more, because I do think events is one aspect of my page, and learn a lot from stories and people's opinion.
Yeah. Well, yeah, we definitely will, and we'll definitely do this again, because I like your name as well, like the diverse. It's a really good, like I think, catchy name to put out there in the community.
Yeah, I had to do quite a think, and I had a poll with my friends, and the end diverse med ed won that poll. So
Yeah,
that's the
yeah. Well, I really like it, and it's good you picked it. But well, thanks for like coming on the podcast today, and I think it's been really nice speaking to you.
Yeah, thank you so much. You made my first podcast interview very, very pleasant, and I really enjoyed this conversation.
Thank you, and so did I.
Bye.